So the way we manage type 2 diabetes currently in the hospital the way we manage type 2 diabetes outside of the hospital setting is outdated. As a clinician, when I see patients in the clinic, we have spotty data. We don't know how the exercise and nutrition relate together with the blood sugar readings. We need the help of technology to make better predictions. And that's when machine learning and AI comes in. So with type 1 diabetes, we have fancy pumps and sensors to help us monitor, but what about type 2 diabetes?
So what Sanam is getting at here are the two major drawbacks for current type 2 diabetes management, which are interpatient variability and personalized treatment plans. So consider two patients who eat the same exact meal at the same exact time, and we see sometimes that they have vastly different glucose readings in the future. So if patient one eats a burger, we see that their glucose is high in the next few hours, and another patient eats the same meal at the same time and has a normal glucose reading. What is happening? So we don't know the effect of different meals on different people. So how do we try and learn this relationship? Now, it would be great if we had meal data paired with glucose data in the future, so we can make correlations between what somebody eats and what their glucose is in the future. Now, we don't have access to both meal and glucose data in the same time series. How do we get this data? Nurse.AI.
So with Nurse.AI, we're trying to tackle three different problems. There's the problem of patient compliance that causes clinics to lose money. There's this problem of missing data that we could do interesting things with, and there's this problem of user experience that causes people to not really use apps out there to actually collect that data. So there's other companies that are doing this, but the biggest problem with them is that it's a very fragmented space, and all of them have proprietary data. We're looking to build something that's much more shared and much more easier for the user. So we're talking about like a whole ecosystem of different apps. Potentially you could imagine like Alexa app that helps you actually administer your insulin. You could imagine dashboards to help doctors pull insights from visualized data. Or you could imagine an app that sends notifications to remind you to record your insulin. But at the end of the day, it's about making the user experience as easy as possible so we can collect the data that we can do and make insights with. So this kind of data, what is it? Well, it's glucose levels, so medical data, it's meals, it's exercise, and that's all a time series.
So given this data for given a large set of data for one patient, we can imagine a scenario where we know how they react to different meals. So this patient eats eggs for breakfast and a burger for lunch, and we know that they're going to have a high glucose level in the PM. So using this prediction, we can suggest an adjustment to their insulin dosage for the PM time period. Now, the average lifetime cost for a person with type 2 diabetes is about $130,000 per person. Even a 0.1 decrease gives us a $3 billion opportunity for this market.
Thank you very much.
Unfortunately, this is a field that I know very, very well. So a couple of pieces.
From you.
Couple of pieces of advice. Do your benchmarking very, very aggressively, because this is an extremely crowded space. There are more apps and more solutions than people can imagine. And by the way, Livongo has just been awarded one of the largest contracts, I think, by the government to go in this direction. The other one is always remember that diabetic patients don't like to be reminded every 30 seconds that they have the disease. They like to think of themselves as normal people. So these very aggressive things where you have to enter every 30 seconds what's happening with their blood glucose, they're not very patient friendly.
Thank you for that.
So I think the big differentiator on that is just, for us, it's about the user experience. And so we're very focused on this idea of not being annoying with notifications, having Alexa maybe chime in a few times, but really offering emotional support in the process. But yeah, very good points.
So I guess to kind of lead off on that, we think the biggest differentiator with this product is the fact that we're correlating with meals and exercise that are essentially unmodeled effects currently with diabetic patients. So that's really where we want to stand out.
I suppose I'll also ask you the question I asked the prior group. You know, I think with a lot of these things, especially once you're though choosing to do disease modification for chronic diseases, the question always comes like, who pays?
So that's what we were about to get to before we ran out of time, unfortunately. So essentially, we would be licensing to clinics who would be able to take advantage of government value-based programs and improve their clinical efficiency through using this app.
What is your target market and what is it valued at?
So the target market for us is people with type 2 diabetes. On the elderly side, people that aren't necessarily as familiar with using all technologies.
And also type 2 diabetes in particular that don't have pumps and sensors. They usually have meters that don't automatically incorporate, diet and exercise and other factors that play a role in their blood sugars.